Hey guys, it's Sarah here. In this video, I'm going to be going over some mnemonics for your cardiac medications. So let's get started. The first cardiac medications that we're going to be talking about are the classes of antihypertensives. The first category we're going to be going over is your ACE inhibitors. Your ACE all end in PRIL. And the way I like to remember that is ACE, so you like to get 100 on something, so think of PRIL, your principal. So ACE, principal, PRIL. And examples of this is lisinopril, enalapril, etc. Another antihypertensive class is your beta blockers, and those all end in OL, so O-L-O-L. And the way I like to remember this is, like LOL. So beta blocker, you better block yourself or else you'll be laughing, like LOL. The next class of medication for the antihypertensives are your ARBs, and these all end in sartan, so TAN. And your ARB stands for angiotensin receptor blocker. So receptors, TAN, when you're tanning, you're getting all the sun, you're a receptor, I guess, and getting all the sun. So receptor, you're tanning, sartan. And some examples of that is valsartan, losartan. The next class is your calcium channel blockers. So calcium channel blockers all end in DIPINE. So calcium, think of your dairy, and think of dipping. So what are you going to dip it in? Dairy, your calcium, your chocolate. So examples of this is amlodipine, nifedipine, nicardipine. So just to go over those antihypertensive ones, and then we'll go on to the next cardiac medications. So the ACE, you have your principal, PRIL, ACE, PRIL, lisinopril, enalapril. You have your beta blockers, OLOL. So you better block yourself or else you'll be laughing. And some examples of this is metoprolol, atenolol, etc. The next class is your ARBs, your receptor blockers. So receptor, you're getting tanned, you're the receptor. And examples of this is sartan, so losartan, valsartan. And then you have your calcium channel blockers, calcium, think of your chocolate because it's both dairy, and your dip, so dipine. So you have your amlodipine, nifedipine, nicardipine. Next we go on to our diuretics, which are also for cardiac because, your heart failure patients, even hypertension, etc. So your diuretics, you have different categories. The first one is your loop. And the way I like to remember this is LL, so loop, Lasix. And another way to remember this is because Lasix has SIX, 6, and loops, 6 loops. So LL, Lasix loop diuretic, and your 6 could also help you remember about a loop. The next class is the potassium sparing, so SS, sparing spironolactone. So your L goes for your Lasix, your S goes for your spironolactone, and your thiazide just has a name in it, hydrochlorothiazide. And then you have osmotic diuretic, and osmotic is water. So just think of mannitol, because only men really swim, like real men swim. So real men swim, osmotic. Next class of cardiac medications are your nitrates. These are really easy because they all have the name nitrate or nitride or something like that in it. So it all has a name in it, so there's no real mnemonic. It's right there. The next and last class of cardiac medications that we're going to be discussing are your statins. Your statins are used for cholesterol, and the way I like to remember this is stat. So how stat means immediately? Like if you have to send the lab or something, stat means immediately. So when people, I want my cholesterol food immediately. You want your donuts right now. You want your cake, your pastry right now. So stat, for your statins, you want your statin food right now. You want your cholesterol right now. So I hope that helps you. That's mnemonics to help you remember your cardiac medications. And if you have any questions or you need other help with other mnemonic, let me know. Please subscribe, like this video, and stay tuned. Bye.